We have several different ways to treat high cholesterol. The most commonly prescribed medications are called statins. We choose high doses of statin in patients that have very elevated cholesterol levels or in patients that are considered to be very high risk of a cardiac event because of their cholesterol. Statins work mainly by decreasing the body's production of cholesterol, but also helping the liver to clear cholesterol from our bodies. Cholesterol is a waxy, fat-like substance that is found in our blood and in all of the cells of our body, and it's actually a necessary building block to make cells healthy. It's typically produced in our liver, but also we get it from some of the foods that we eat, like meats and other types of dairy products. But the problem is that when cholesterol levels get too high, those levels can actually cause cholesterol plaques to deposit in the arteries of our body. And sometimes those plaques become unstable. They can cause things like a heart attack if it's the arteries of the heart, or a stroke when it's the arteries of the brain, or something called peripheral vascular disease, which is arteries of the legs and the limbs. Treatment for cholesterol largely depends on risk. Typically, the people that we think of as high risk, if a person has already had a cardiac event, those with diabetes, older age, people with a smoking history, patients with high blood pressure, patients that have a strong family history of cardiac disease, or patients that have a genetic predisposition to high cholesterol. Because we know that high-dose statins have a much higher effectiveness in lowering cholesterol, typically, in most patients that a cardiologist is seeing, we choose to use a high dose or a moderate dose of a statin in order to lower cholesterol levels. In general, statins are really well tolerated by patients, other than some annoying side effects. Certainly, there are not any major life-threatening side effects that we see from statin use, even in the highest doses of statins.